We're recording. Ready? Okay. I'd like to call a special meeting of the Arcata Fire District to order. If you'd like to take a roll.
Take all of district members, please.
Director Manor,
Yes. Here.
Vice President Johnson is absent. Director Mendoza,
Here.
Director Loudenslider,
Here.
and President Akon is absent.
Mayor Stillman, present. Vice Mayor White, here. Councilmember Atkins Salazar, here. Councilmember Matthews, here. Councilmember Schaefer is absent, but we do have a quorum.
I think we are expecting her to show up.
Yeah, she's putting it on for school, so she said she might be.
Okay, Director Mayor, would you have the agenda with you?
I do not.
Okay, I'll go ahead and do it.
Okay, yeah.
So at this point, we have public comment, and during special meetings, public comment is only taken at the beginning of the meeting pursuant to the Brown Act, section 954.3A. The public comment period provides an opportunity for people to address the council only on items that are listed on the special city council meeting agenda. At this point, I would defer to you to ask if there's any public comment.
Is there any public comment? We're gonna limit it to 3 minutes. Is that
It'll be limited to 3 minutes.
limited to 3 minutes?
Yes.
Yeah,
Yes.
Yeah, if you guys just want to line up over there.
Hold on, I'm good.
Okay.
Good afternoon,
Hold on,
I'm
hold on.
Fred Wise.
Let me get a timer started. So we say 3 minutes?
Sure.
Wait. All right.
Yeah, I'm Fred Wise. Thank you for being here today. I submitted a letter, which I hope you've read all or part of. I wanted to make one correction to my letter. The story at the end about the students who are roommates in the new dorm building, they aren't, I said they're freshmen, they're not freshmen. One correction. The other correction is that the hammer they purchased is a hammer specifically designed to break glass. I didn't mention that. I run the arcata1.com website. There is a section there on fire protection. You can get there by arcata1.com/fire or just from the homepage. There's a section specifically on that. You've read my letter, so you know how I feel, what I'm suggesting. At the study session, I think you have several tasks you can choose from. My suggestion is first, let the AFD board talk about the Tri-Town report and their feelings about it. I feel strongly that it should be rejected. Tri-Town should be given 90 days to revise it. The AFD board can certainly assist them in the revision. Not willing to do that, or if the revision is not acceptable, then we should get a refund. The report does not fulfill what it was stated we wanted. This report, I think, to accept it would be an insult to the people of the city of Arcata. The other thing, that's the first order of business, and perhaps a discussion of what in the report is valuable and what is missing. Other items which I'd like to see, but I don't know if I'm going to get to, is to determine the actual legal liability situation. I don't think it's clear cut. Normally the city is shielded from liability. In this particular case, for reasons I've explained in the letter and other reasons, it may not be, and I think that's a major consequence. Third, the city needs to decide whether to grant permits for four-story buildings in this interim period. And the AFD needs to determine and tell us under what conditions would four-story buildings be allowed. In other words, perhaps after a positive election results and after the 2026 election, or what constitutes an adequate sign that there's a pathway to financial success, I'll say, okay? 3 years ago,
15 seconds.
what then AFD board president Eric Loudenslider said, it seems incomprehensible to me that a recommendation on building height could come out of the planning commission or the city council until we have full economic analysis of what it's going to cost the city.
That's fine. Thank you.
Okay, thanks very much.
Good afternoon, Gregory Daggett. I also submitted a letter to everyone here. I'd first like to start out and say our university systems, whether it's Cal State or UC systems, are supposed to be the gold standard of doing things right. And I was one of the few people that actually backed up in the EIR for the university's approval. And I mean, I was pretty shocked. I mean, appreciative that they wrote back, but pretty shocked about what they said, how insignificant all this was. And they kept on using that word, not significant. So this is very significant. And now we have a building in front of us. And you can see for the record what, the fire district has said that, we don't have the support for those students if anything goes wrong. And I would also like to say that we've already had a test run of this with Sora Place, which was a 4-story building after our city council approved of the gateway in the general plan, which is 4 to 7 stories. And that trial run was, there was a fire. And their spokesperson, I noticed, just recently said that, don't worry, Humboldt Fire has a ladder truck and they can assist us. Well, in that emergency call, they were not available. So it isn't just earthquakes or some of the natural disasters. It could be that they're just busy and they can't respond. So, it's just, you're gambling here. And unfortunately, our city council just followed right in your footsteps. And even though there were positions on the Gateway 2045 and that they basically, if you saw anything that was going to be detrimental to the safety of the public, that you couldn't vote for it. And you still voted for it, even with a letter from the fire district stating that all the reasons that you should postpone this vote until at least the standards of the coverage and the financial situation was addressed. And speaking of the financial direction here, we have the university. I don't think they're going to be paying for supplement individuals to be hired and the ladder truck. We have, what else? We have the big developers. We have, let's say, Sora Place. Pardon?
30 seconds.
They don't pay taxes and they pay very little for the fire district. I think it's less than $500. Then you have the public, which I think in this report, basically maybe the cost of living, they could deal with that. But there's no money for standpoint of, this $15 to $20 million. And then where is McGuire in this? Because my understanding was that if we got this report done, then possibly we're gonna get money from the state. So where is that?
Hello, my name's Joanne McGarry. I really appreciate actually having this meeting in this facility as opposed to the council chambers. It's a little more intimate and the citizens can feel a little bit closer and hear a little bit better what all the people around this major table are talking about. I don't do my homework as well as Fred and Gregory do, and I have yet to completely read the full report. I just came from campus where I was in a class that at the end of the class, I was talking to some of the students and learned about an incident at the new dormitories recently that one of the students was concerned about that involved carbon monoxide. I've also went to the Home Away from Home event and learned from one of the students that I was talking to there who lives there some interesting information, not specifically about fire, but just about design and other matters of that facility. I have been and visited that new dormitory 4 times now and was able to go upstairs with the student helping her move in. And then, walk down the hallway and decided to take the stairway down instead of the elevator to just get a sense of how it all, quote, works for people. And I really do think that I go back to my philosophy about housing and thrivability for people, including the students who are here for just maybe a brief time. 3 stories and a functional rooftop, that is the rural college community of Arcata. So this is an aberration, in my opinion, and that we should really be focusing our future design on livable, thrivable, safe, sane, and affordable housing for all. And that's all I want to say right now, but if you haven't been there yet, try and get in.
Thanks.
Well, group, thanks for this meeting and late coming, but here it is. So I don't want to take up a whole lot of your time. The speakers have covered a lot of what I want to say, but I really would like to, I don't know if advise is the right word, but recommend in the future for meetings on this subject matter to really try to get a representative from McGuire's office and from Cal Poly. I don't know if there's someone here today, but I think it's going to be critical to make this all happen and continue on with building houses that are going to house everybody. We've got to get this dealt with, and I think you can raise the taxes a bit. I think people might fall a bit for that, but I don't think you're going to get too far with the amount of money it looks like you need to make this all happen and safe with what the fire department in this area needs to do. I mean, a group effort with the rest of the counties might be a helpful viability to all group together and get the state to try to build a bigger system that's all collective. I don't know, but I think you're gonna have to get the state, they're running pretty dry. So anyway, I recommend getting folks at a higher level for these meetings and really reach out to make sure that they realize what's happened and what's going on and where we need to go. Okay, thank you.
Thanks, Chris. Is there anyone else who would like a public comment? I see no one. We can close public comment.
Recommend.
Yeah, let's close public comment and move on.
Okay, so at this point, we'll have the discussion and receive the Arcata Fire District Standards of Coverage report from AB Triton. Our consultant is David Rocha.
Right. So, good afternoon. So, as the chief mentioned, I'm Dave Rocha. I am with KP Triton. This has been a report that's been kind of a long time coming. We were here a little over a year ago on site to start the visits and collect information. There's been delays for a number of different reasons. I'm sure many of you are aware, just trying to one schedule and then kind of a false start back in July with trying to get a meeting done. But I've been just a little bit of my background. I've been with AP Triton for about 2 years now. Prior to that, I worked in the Department of Emergency Management, the city and county of San Francisco for about 2 years. And 33 years prior to that, for the 33 years prior to that, I was in the Alameda County Fire Department in the San Francisco East Bay. It's a larger department that started with a lot of smaller departments that came together over the years. So when I retired as the active fire chief, we had 35 stations covering everything from the communities up in the north, some of the north part of the county, all the way up into the east and kind of the south county. And just for the record, I don't think because of the way introductions were done, there are folks that are here from Cal Poly that are attending. The report was kind of a 3-part report, which I think was the success right from the beginning is the city, the fire district, and Cal Poly trying to work together on the report and take a look at the information. Standards of coverage and risk assessments are kind of a foundational report overall. A standards of coverage deployment analysis is really the report card on how the department's doing, or how the fire protection district, sometimes department and district quite often. But in terms of looking at it, we take the information, we collect all of the data from the department. We look at their fire records management system. We look at the CAD system, which is the dispatch data, which is data that can't really be changed, but that's through CAL FIRE. There are some shortcomings or gaps in the way some of the data is collected, we'll talk about.
as we go through it. But we take that and we measure it to standards, national standards in many cases. I will tell you early on, many departments, not just the Arcata Fire Department, don't meet the NFPA standards. The Alameda County Fire Department, which I came from, there were a lot of the standards we did not meet in terms of staffing and response times and things like that. Large county, large areas to cover, those sorts of things. Community risk assessment is looking specifically at your hazards that are in the community. Some of those hazards are things that people have already talked about a little bit. Others are natural hazards and things like that, and evaluating them and scoring them and looking at frequency. The frequency of an emergency medical call is very high, but the impact on the department is much lower than a fire. If you had a fire or you had a broken sprinkler head in a large building, it takes a lot of people to do those sorts of things. So we look at that, and as we go through the report, I'll talk a little bit about how that's evaluated. We're covering kind of the top tier information today in terms of being able to go into the report and for you to be able to pull out information that's in there and evaluate it. This report, in addition to looking at the standards of coverage and the community risk assessment, asks us to take a deeper dive into the finances with feasibility analysis. The department has difficulties. That's clear. We'll talk some about that today. There are some things that are in the report on things that will be helpful. There is no, kind of silver bullet to this to solve the problem all the way across the board. A lot of things have to happen across the board. All right, so the report, if you look at the report, it's broken down into multiple sections. I've talked a little bit about that. Kind of an evaluation of current conditions when you look at that, what's going on in the department, how the department's organized today, how staffing's done, community risk assessment, standards coverage. Then there's some recommendations that come toward the end of the report. And then we've also got kind of an extra section. Like I said, we did the standard, the way that things were laid out and scope of work for us to do was the standards coverage, the community risk assessment, and then this finance thing. So when you look at the report, there's actually two sets of recommendations that fall in that. We did some of the work on finance later on with the help of the city, looking at development and things like that. Okay, so from an organizational standpoint, Fire Protection District is an independent fire protection district. What that means is that it has its own board that operates independently. There are different types of districts that are out there. The Alameda County Fire Department was a dependent district, which meant that my board of directors were the county supervisors. So it's a different form of that. The Arcata Fire Protection District is separate from the city. Once again, we appreciate the city, or they appreciate, I know for sure, the city being involved, but you cover the city. Fire Protection District overlays the city in the way it's formed. So there are many communities. There's a board of 5 that they're covered. We have a fairly small staff for operating the district. In terms of things, 3 fire stations they operate out of and 18 firefighters across 3 shifts, the 18 firefighters. So when you look at it from an organizational standpoint, just a little bit about what I was talking about. The center column, there's 3 shifts. So the firefighters work on a shift schedule so that there are generally, when we talk about 18, it's 18 divided by 3. So there's 6 per day spread between the 3 stations, 2-person staffing at each one of the stations. That's well below in terms of not meeting standards, not meeting the NFPA standards on staffing. The NFPA standards for staffing talk about 4-person staffing. The Alameda County Fire Department, where I came from, I said we had 35 stations. I only had 4 stations that had 4-person staffing on and apparatus. So we had 3-person engines and 3-person trucks as well in many cases. The only places that we actually had 4-person staffing was our rescue company. It was a countywide service that we provided. And then at the Livermore lab and the Berkeley lab, under the federal government contracts that we have. Yeah. Most fire departments in California staff 3-person companies. That's more common. In terms of planning, the department has a lot of things that are in place. They're doing a lot of things right. This sometimes, because I mentioned earlier, we talked about it being a report card. Sometimes the focus seems a little bit on the kind of downside or the negative side. as we go through things. The department's doing a lot of things right in assessing where they're at. There are some gaps when we look at data and things on how they collect things that we'll talk about a little bit later, but they're focused on addressing their future needs. They're looking at their finances. They've been looking at them very closely. It's a very difficult argument sometimes to explain. California and taxes and everything are very complicated in the way it's done. We did some things in the report toward the end. We had to make some assumptions on what's going to happen here for development. And you're never really quite sure, even with plans that are approved, and whether they're going to really move forward. I think we got it right for the most part with the help of the city. So capital facilities. The capital facilities stations were in pretty good shape. The McKinleyville Station, which is the headquarters for the Fire Protection District, station age is very high, but it's been redone over the years. It's in good shape. This station's in pretty good shape overall, a very large building itself. The Mad River Station was a bit fair. For two people, it works. It's a very small station. Apparatus bay is very small, probably undersized in terms of modern fire apparatus and being able to get things in. It also is the Fire Protection District's training center or training area of sorts. They have a building in back that they can store things, they got some props and things like that. But it's such a small station that when you look at the station itself and how things are set up, it's very difficult to say that it's really built for modern fire service. That's fire service where you've got men and women in the fire service working. So it's a very small building, okay, and really going to need some focus in the future. So overall capital facilities, in terms of the department itself, talked about we measure to NFPA 1910 across the board, looking at how things are at. That talks about replacements on engines and replacements on trucks, and looking at those things as you move forward and how those things are done. So while some of the minor maintenance happens in-house, other maintenance has to be outsourced here. There's a key part of NFPA 1910, which talks about emergency vehicle technicians working on it. Because of your location, there's not a lot, or any, I think, emergency vehicle technicians in the area to be able to work on your apparatus. Same sort of thing actually happens in the Bay Area. We're a big enough agency that we had a maintenance facility ourselves. They were all certified. Other folks had to drive from the Bay Area out to the Central Valley to get to emergency vehicle technicians. So it's not uncommon, but you've got to be very cautious. There's a lot of electronics on any vehicle today, but it's a significant amount of electronics on a fire engine, modern fire engines that you have today, and working on them really is a specialty overall. So the district does its preventative maintenance and does the things that it's supposed to do. Some of the engines and things are in poor shape. That's more of a budgetary sort of thing to look at when you're planning and looking in advance that what you're going to have to purchase, and kind of trying to lay those out and set aside money today for the future. That's very difficult to do when you've got financial constraints that you're under as an agency overall. Other capital, in addition to the fire stations, the apparatus, AEDs, automatic defibrillators, are an expensive item that the Fire Protection District needs to maintain. Extrication tools fit into that category as well. It's been a very significant expense for any fire protection district overall. And I forgot to mention, if you remember that on the council or director, or even the staff, if you're seated at the table, you want to ask questions as we go through, please do that. This is a workshop, not to hear just me talk.
Thank you.
All right, so communication. So like many places, more commonly probably rural throughout the state or smaller fire protection districts, the Arcata Fire Protection District is dispatched by CAL FIRE. There are some things in the way CAL FIRE collects data, does what they call reach back, that creates some data gaps that you don't normally see in reports or the reports we try to do. One of them is when the engine starts to roll, what happens is they'll leave the fire station, they wait for CAL FIRE to call them and ask them if they're on the road, versus automatically saying to a dispatch center that they're on the road. that creates a gap. We don't know from the time of tone going off in the building, to the wheels rolling on the engine. We know that it could be down the road on that. So that does create a bit of a call processing issue for us. So as we go through this, we'll talk about it's everything. What we try to do is measure all these time increments from the time of dispatch or from the time the call is made to the time of dispatch, the time of arrival. Excuse me. And it's arrival, one of the key things, it's arrival at the address. So the larger, more complex buildings, when you do build them, it takes time to get to an upper floor, to get to somewhere else. So that's not a time today that's measured. We've talked about it in the fire service over the years, but the time being at a patient's side or being on the fire floor or anything like that. So anyway, so the CAL FIRE, the approximately 6 minutes and 36 seconds, 90% of the time in terms of their call processing time. So you'll see that's a little bit on the high side, but there's some gaps in that in terms of how we are able to collect the data. Emergency medical services, the Fire Protection District provides basic life support for EMT level services. It's not uncommon in the state of California to see paramedics on fire engines. So that would be an enhancement for the district to possibly look at in the future in terms of providing medical care. One of the things when you're looking at that is what's the time for the ambulance coming in behind that does have a paramedic or provides advanced life support today? Are there delays? We didn't hear a lot of that from the staff when we talked about them, about wait times and waiting for ambulances and turnaround times at the hospital, wall times is another point that's regulated throughout the state. The EMS agency that's a multi-county agency for Humboldt County has to measure that. That's a state requirement that they're looking at what they call APOC, is the abbreviation. So anyway, so lost my spot there, train of thought there for a second. So the department responds to about a little over 7,000 emergency medical calls a year. You'll see as we get a little further into the data that it's a fire district. Number one thing that they do is respond to emergency medical services types of calls. And the North Coast Emergency Medical Service Agency is that multi-county agency that looks at. When we went through and we wanted to look at granular data, this is one of the shortcomings that we found. When we wanted to really get into the granular data and know what types of emergency medical calls, because it's kind of a public health view of things, to look at things, we couldn't get down beyond just basic medical. So in that RMS system, getting that reporting or getting a little more granular in the data that you are collecting is a recommendation that we have. It carries over as well into some other things. And I think important in this community, when you look at it and heard the questions and folks about the impact of the university on the community. They don't capture data today other than by address, knowing whether it was a student or non-student. So key factor, look at collecting maybe as you go forward, data that says when you're with somebody and you don't need to get into the dip. We've seen in other places where they try to get too much, I think, into the demographics of everybody that they're collecting data from. That becomes a problem when you're trying to treat somebody in an emergency medical scene. But just knowing whether they're a student or a non-student. And I think the other thing for this community that I would focus on is unhoused. Whether you've got, it's kind of easier to pick out somebody that doesn't have an address necessarily, but being able to capture those two things, I think are important things for your community. Kind of more, like I said, from a public health sort of standpoint as you look at them.
When you're referring to students, you're referring to grammar school, elementary.
Well, you could. Well, I would refer to you. I was referring to university.
Okay.
Yeah, I think that's been the big question. I think that we keep carrying up. It was, and the report was standards covered community risk assessment. A lot of questions and things have been brought up about what the university should pay. That was not part of what we were asked to do. And I would tell you, state law today exempts the university from paying property taxes, which are the main source of fire protection district income overall.
talk a little bit about that as we go on.
I got it.
Yes,
I'm not, are you using a different format than the report that we have? Or
no.
is it, what page are you on?
Oh, well, this is a presentation. This is not the report. I'm not going through
Oh,
the 280 slides.
I thought you were gonna help us figure out how to work the report.
Yeah, we're kind of talking about the parts of the report, but this is in the EMS. These are the highlights from the EMS, the Emergency Medical Services section of the report itself. We'll talk a little bit about some of the other sections as we get into it as well.
Okay.
All right. All right. District Fire Marshal, the Fire Marshal manages all things the the Arcata Fire Protection District completes 100% of its state mandated inspections yearly, which is good. I mean, that's a good thing. You don't see a lot of departments, even though they're mandated, that actually hit that target. And they're on a two-year cycle. The fire prevention staff is used to do the more complicated inspections, which is traditional function of fire prevention bureaus across the board. The vegetation management enforcement is only done on when there's complaints. So they're not out proactively doing vegetation management inspections. You'll see some agencies, CAL FIRE does that. Yeah, the agency I came from did not go out and do that. We did the same thing with complaints only. But if you go back about a decade ago, CAL FIRE did a special assessment that even overlaid fire protection districts in certain areas to go out to state responsibility areas to be able to have an inspection program to do those things, to start creating the zones around your home for protection. So we talked about an example of model programs falls into NFPA 1730 overall. So that would be a place to look at when you're looking to improve your program and look at what you're doing. That kind of gives you what's the criteria for a model program overall in terms of evaluating it and looking at it as a fire prevention bureau. Right, special operations. Essentially, they've got folks that are trained in certain areas, but they're reliant on countywide teams for the most part when it comes to hazardous materials response. If they get anything that's more significant, they're going to do anything more than kind of take a defensive, what we call a defensive posture in terms of what they're doing. That's an operational level. If they're going to move into being a technician or specialist, they are reliant on the county team. It takes time to come together. It takes time to respond to all of those things. So you can factor in that that's going to take quite a while. One of the things, there are no currently certified hazmat safety officers. That's actually a requirement on a hazmat call when you start to do some of the higher level stuff, to have hazmat safety officers in it or in. Folks are confined space awareness trained. Once again, there's awareness. There's an operational level, and there's a technician level to doing confined space things and doing rescue things. They've got some training in low angle rope operations, which makes sense given some of the hills and things around this area. I personally was a little bit surprised when we talked about water rescue and it really being shore-based, that they have no capability to do anything other than shore-based water rescue in terms of what they do. Training. So you have an assistant chief that's responsible for, in addition to all sorts of other duties, as an assistant chief responding to calls and doing those sorts of things, is responsible for overseeing and developing the annual multi-year training plan. So that is, from a staffing standpoint, you've got one person that's wearing many hats to do a lot of different tasks, and then to manage to make sure that people are completing training throughout the organization and record keeping and all of the things that go into that to make sure. Where this is really critically important, and I'll say more from a day-to-day or standpoint, is if somebody is hurt in the department, OSHA's going to come in and ask you for all your training records. That's the first thing they do when they come in, is want to look at training records. So it's critical to have those things in place. That's something that's more often going to happen to you or happen to an agency overall in terms of their record keeping and looking at training. I'm sorry, I can only take questions, so you raise your hand.
I was just shifting.
Oh, no, the person next to you, sorry. From the folks that are on council or directors or the staff at the table, but I think in the end, they have another chance for public comment. The Mad River location, I've already mentioned this, they've got a mobile tower that they use. It's very limited in terms of their props and ability. In fact, the entire region is very limited in their ability to do training and the props that they have in terms of the fire service. It's one of the areas that we think there's some regional things that could be done for the agencies that would work together better overall in looking at things and being able to do manipulative training. Because the problem today, but when you look at that, you need to be able to move people out, do other things. And then when you move them out to do those things, to go to a training facility, they're not necessarily in their district. So you have to have coverage plans before trying to do that. The Vector Solutions platform is just an online training platform that they keep records in. There's online training that's available for them as well. Community risk. So this is where, when you look at the fire protection district itself, you start to look at the demographics overall and what risk factors there are. And in communities where you have a lot of older people, you see a lot more aging folks that have ALS, advanced medical life support issues in terms of responses that they have. So we look at that data. One of the things, and you've got slides that have other things, I don't want to jump too far ahead, but I mentioned it already. We tried to look specifically at student population, and other than the addresses on the campus, we're not able to identify that the university students. So that's something we felt needs to be collected through the overall data. Looking at the natural hazards and factors that you have, I think the last time I headed up here for a meeting, you guys are unique in some ways, but tsunamis. I mean, I got the end of July when I was coming up, I passed through a handful of tsunami warnings on my way up. Not something that we necessarily see in the San Francisco East Bay where I came from. It's a very low, it's a low frequency sort of item that comes up. But where you're at up here, down in Santa Cruz, I know they've had issues with it as well. We looked at land use and zoning risk characteristics overall for you. One of the things when it comes to land use, we're not recommending that you do one thing or another. We lay out some of the parameters for you as an elected body for the city, for the fire protection district. You have responsibilities as well to understand these standards when you're making decisions overall on what you're doing and what you're planning as you move forward. All right, so when you get into the community risk assessment portion of the report, and I talked a little bit about this already, this is a graph, and there's many graphs that appear in there. And what you look at is the probability of something. So this is emergency medical call. Probability is very high. They go on a handful to 7,000 calls a year between the three stations. So they're going on a few medical calls a day or several medical calls a day. The impact overall on the agency is smaller. I will tell you that the impact on the Arcata Fire Protection District going on a medical call is higher than you normally see in many fire departments. And the reason being is that two-person staff. It makes a bigger impact on their ability to continue to provide fire protection overall or medical response overall. So that is a factor overall when you look at that. So when you go through the report and you're assessing those things, there's the probability of something happening, and then there's the impact that it has on the agency overall that we tried to look at as you're moving through that. So that's a medical call. If we were talking about fire in a high rise, probability is going to be lower. There's not as many up here. There's only a couple, I think, that would even qualify. Lower impact's going to be really significant. And when we get into critical tasking, I'm kind of jumping ahead, but
Is it not moving?
It's not moving. Yeah.
Okay, so well, let me just mention one thing. You mentioned water rescue, and now we have the Coast Guard here.
Mhm.
And the Coast Guard actually does water rescue,
Yes,
so we're pretty well covered down there.
you are. The Coast Guard has an overall standard. They won't operate less than 6 feet of water. So that is just because of the types of boats that they operate and things like that. I haven't looked up and down the shoreline over, but that in our area, I know it was always kind of an issue. Not for my department, but one of the nearby departments ended up at where they only did shore base, but the Coast Guard wouldn't come in. So off the island, and they had a gap in protection. So that's the only reason I brought it up earlier.
Before I could review rivers, because if you go out into our bay, you're gonna sink into the mud. Hopefully you're not going further. You just
Understood.
go around in it.
Yeah. We had mud boats, our rescue carried all kinds of plywood. That was the only way we were gonna make it out into the bay at some points in time. In all honesty, because you couldn't walk out there. We had, these big ski or snowshoe sorts of things that we've had for boats as well. So this gives you an idea. Earlier I mentioned, almost 57% of the calls the agency goes on are rescue or medical, and these are in-first category groups that are here, and they get broken down further based on choices that people make. But once again, service calls and emergency medical are the top two categories, not uncommon in today's fire service. Overall, fires here actually reported in at about 6.5%. That is a little bit on the higher side than what we see sometimes as well. In good intent, I sometimes gather those with service calls myself. But then one of the things we've got at the bottom is mutual aid, the received and given. That's an important part. Yes.
Any way to make this a little bigger by using the full screen? I'm probably the only one who's having difficulty reading. Okay, thank you.
But you have the Zoom link up on.
I'm probably the only one.
I'm close and I have an issue too. There's a bit of a glare coming off it, so I have to look at it sometimes. I'm like, oh. There we go. That's a little bigger.
We don't need to look at ourselves.
But so you've got the table that breaks down the types of calls. In terms of areas, here's your this is what we call a heat map. It identifies kind of the areas where more calls overall happen. They're kind of in those population areas that you've got the Mad River. I'm trying to remember and look a little bit closer. There were a couple little, did I get too close? There were a couple little odd spots in things that when you looked at that were near like where the highway intersections were. And I think there were encampments and things like that. So they drove up some call volume when we looked at it. They weren't like official population centers, but there were these unofficial kind of population centers.
There are also accidents and those joint.
Oh, there's accidents, yeah, certainly there's accidents, vehicle accidents, yeah. And things like that. But this gives you an idea of where generally the overall call volume, I mean, the calls that they're responding to, they're outside the red line gives you the fire protection district itself. Anywhere on the screen? Call volume by year, an odd, for some reason it's only got 1, 2, 3, 4 at the bottom on the slide. But one of the oddities in data collection, once again, not unique to the Arcata Fire Protection District. Everybody started, when we had the pandemic, everyone thought call volume was going to go through the roof and responses were going to go crazy. And I think really, at least in all of the areas I've done work, there's a significant drop off in call volume. I know, like I said, my history in Alameda County, call volume went way down. Ambulance providers under contract with the county, they actually started laying off people because they didn't have the calls to have the staff to do. So it was just this weird sort of that people didn't want anybody coming to their homes. They didn't want to go to the hospital. There's all these weird things that happen. So that's kind of a weird year to include in any study. But the department's running a little over 3,000 calls, mid 3,000s in terms of on regular years. Incident volume by percentage by month. This is one that when we looked at it, the data itself, the things, I mean, there's a little bit of change in volume overall in the numbers. I would have expected if there was a significant impact by the university, you to see in the months where students come back to school to see a bump. And I know we've seen that other places where that first month seems like the kids that haven't been away from home, that are getting away from home for the first time, all start running into having issues. I know my 3 kids, when they went to college, they all talked about how crazy things were for the first month. And then, you know, you kind of people figured things out. So, but the call volume percentage wise by month stayed very similar, kind of across the board, little bit of a change when we got into that. By hour, this is very traditional in terms of the fire service at large. During the day, you'll usually see things start to bump up about the time people are waking up, going to work, doing those things, commuting to work, stays high throughout the day and the early evening, and then drops off again. So nothing really surprising or unique to the Arcata Fire Protection District when we looked at this. Right. And there's nothing in the day of the week as well. If you look in the report, there's assessments. So these are travel maps. These are insurance rating schedules. Insurance Services Office, ISO comes in and rates fire departments overall. So when you look at a 5-mile radius travel distance from stations and a 1.5 mile. So ISO likes to see that 1.5 mile travel, but you've got some gaps in terms of fire stations in meeting that. It's not uncommon for there to be gaps in that. The 5 mile, you get closer in terms of minimum coverage, at least in the populated areas for the most part. But what they're evaluating is your ability to produce an engine on a call and the ability to get a truck to a call. Arcata Fire Protection District does not have a truck to respond. So. All right, so critical tasking. This is another part of the report. There's a lot of information in it when you start to look at it, and it breaks it down by different types of emergencies and different levels of emergency overall. So this is a moderate risk fire. What we count in terms of personnel, when you look at it, you've got 3 engines, 6 personnel, call it a battalion chief. You have a chief officer that's on call. That chief officer rotates chief directly through the fire chief and the 2 assistant chiefs. In terms of, you don't have a battalion chief necessarily 24/7 sitting in a fire station, but you have a battalion chief in the system in the community that responds from home overnight. Yeah. So what we do count is the resource the Arcata Fire Protection District can deploy and the automatic aid resources that you can produce as well, or have agreements with other agencies to produce. We don't count mutual aid. And you ask, well, what's the difference between automatic aid and mutual aid? Automatic aid means that when the Arcata Fire Protection District makes a request of a nearby fire agency to provide resources, they send them. They send whatever number they've agreed to by contract or informal agreement, they're going to respond to that. Mutual aid is different. Mutual aid is a request that then on the other end, they evaluate to determine whether they have the ability to respond to the call. So there's an inherent delay in those resources. There's also up here an issue where you've got career firefighters in paid departments, and you've got many small districts that are volunteer in the area as well. And you count on the volunteers to respond. They fit into that kind of mutual aid category as well for resources. So if you have a moderate risk fire, so a moderate fire, they said staff available is 14, staff needed was 15 for the moderate fire. So this is kind of your basic residential sort of fire. You're one short in terms of efficiency on being able to fill critical tasks that are needed. You need to have somebody that's in charge, that's running the fire, that's kind of calling the shots and directing people on what to do. That person can be the safety person at the same time. It's not optimal to do that, but they can be the safety. In this critical tasking, there's not search and rescue happening because they don't have the staff to do that. But you have staff that's on a fire attack line and on a backup line that could be searching while they're pulling the line into a home. You need the water supply. The water supply is from the hydrant, the fire engine that's in front of the house. So you need somebody that's able to do that. Somebody that stays with the pump to operate the pump. You need people to do ventilation. Ventilation in a fire is critical. So if you have a fire here in this room, ventilation essentially is done one of two ways. One way is to cut a hole in the roof. So you need people on the roof that are able to cut a hole to let the heat out so that the firefighters could actually progress to come in. So that's critical because the room could get so hot that they can't advance forward, even with all the protective gear, if the room's too hot, that they need that little bit of relief that's created by having holes. The other way to do it is consider positive pressure or setting a fan up, blowing air in and blowing air out. In this sort of scenario, probably not optimal to what, I mean, you got a floor above us, but it also pushes the oxygen into the fire. So you need to be right on it if you're coming in to do that sort of thing. Utilities, it's always key to shut the utilities off at a residence or any building when you're going in a fire, because when you start to open up the ceiling and open up the wall, you're going to run into electrical lines. And we don't want a firefighter getting shocked, hurt, killed from utilities. We didn't put anybody for medical. If you have a patient, that's going to take people away from, if they find a victim, then all of a sudden your folks are focused on the victim. And then rapid intervention. So another one of the OSHA standards is what they call 2 in, 2 out. When you have 2 people inside fighting the fire, you have to have 2 people outside that are ready to be able to rescue them. So that factors into this, and that's where you start to, I mean, you've got the entire department on fire and other agencies that are coming in to support to be able to make this fire really work. Yes.
Are you saying these are the numbers that we need for a moderate fire? Or are you saying that these are the numbers that we typically have? That seems a little different from what our staff has told me. That
So
you can get 14 to a moderate fire.
You have, so our indication that we were given on the day, the data we were given is the department staff 7, that's everybody available, right? That's the 3 stations, 2 people each, and then the on-call chief officer. So that's your 7 there. And then going to automatic aid, you're gonna there's a request, it's gonna get 2 more units that will bring in 6 people and another chief officer that gives you another 7 for 14. But the indication is what you'd like to have is 15. So you're short on a basic fire.
It just seems different than what I've been told, because what we've been told is that we double calls about a third of the time, where we have more than 1 call going on at a time. And we've also been told that it's difficult for the volunteers to respond.
Yeah.
And also I know Humboldt Bay has been short. So just, is this a realistic number?
These are numbers that you'd like to have, that if everybody's available, I think are in place. That's probably the way to look at it. So if somebody else is on a medical call, which there are, there's one of the charts we do, it talks about concurrent calls and overlapping calls that are happening. I will tell you that on a serious medical call, you can end up with 2 engines on that call. I mean, if you have person that's pulseless and non-breathing, ambulance has a response time, of some time. You need 2 engines would be the right amount of, you need 4 people to run that type of call adequately. Somebody giving them breath, air, somebody doing compressions, somebody collecting patient information, somebody to relieve and do the other thing we collect data that we need to do. So and from an interjurisdictional response, so there's a good kind of segue into this. This is what resources within the report you can look at and see where they're coming from. I mean, if you look all the way down, I don't know what the Del or Rio Del Fire Protection District response time is, but they're on kind of that group of people that you may be calling. Response time.
45 minutes.
Yeah, that's a long time in a fire. It's a long time on a medical call.
But is that logical? They ask Rio Del to come all the way up to Arcata when
No, I mean, you start closer. I mean, the way mutual or automatic aid works is you start hopefully with the closest units. Rarely there's reasons to skip. But we were talking a little bit earlier, I mean, from a critical tasking standpoint, if you're looking at a larger building and a fire, the number goes 27 for a mid-rise sort of building and 42 when you look at NFPA for a high-rise. 42, you're going to they're calling everybody in the county to get her. And that's, yes.
What's that distinction though? Because I feel like we're using mid-rise and high-rise pretty just flippantly. I don't think we have anything that is considered high-rise in Arcata at least, but
So
not.
4 stories or more? Nothing? 70, everything's under 75? Yep, okay.
Except for.
Yeah.
Not anymore.
But we're under 75. They're right at, I think it's 75 feet. This is the weird part, or correct me if I'm wrong, to the occupied floor. Yeah, so it's.
And you're saying that's mid-rise?
That's the crossover to high rise, anything above 75 feet.
Okay.
To the floor that you're standing.
So we have mid-rise,
You have things that are in mid-rise.
which is important because when you're rural, things that are tall seem like a high-rise, but it's not. So I think it's just, I appreciate that distinction there.
Can you repeat that number for mid-rise? How many?
Off the top of my head, it's 27.
In what time period? Arrival time?
Yeah, you'd like to see them in 8 minutes, but that's,
Okay.
yeah.
Well, that's.
Travel time.
Some of our colleagues did here, 8-minute travel. Which means that you can't get from here to Eureka.
Yeah, I mean, and that's not uncommon. Like I said earlier, we couldn't get the certain response times, even with all of the resources we have. It was easier to do because we ran a regional dispatch center as well. And we had automatic aid agreements with the cities around us. But yeah, you have to evaluate what you're doing in terms of understanding the standards and understanding the risk as well to be accepted. I talked about earlier, so 90th percentile turnout times. What we look at, and this is the breakdown overall of kind of a call from state of nothing going on, the discovery of the event, rolling through. So all calls that come to 911 are required to be cleared by a PSAP, law enforcement. So they go to law enforcement first before they roll here to CAL Fire Dispatch, secondary dispatch center. That is not uncommon. Happened in Alameda County. We took calls from sheriff's office. We took calls from 3 of our 5 cities, laboratories as well, where they all went to law enforcement first before they came to the fire dispatch center. But this lists the benchmarks in terms of call time and processing. 60 seconds, 90% of the time for call processing, turnout times. This is something that's critical. This is something many times you can't, I would say, we're not asking the firefighters to drive faster and fire engines to make these travel times seem like they're long, be able to cover longer distances. But there are things like turnout time. The time from the time the tone goes off in the building to the time the wheels are rolling on the fire engine is considered the turnout time. You'll see those times fluctuate by time of day because the firefighter shift schedule takes a little bit longer to get out of the building sometimes at night than it does during the day. Depends on where you're at. You may be out driving around with the engine and the call comes in and you're immediately responding. That drops the call, that response time to 0 overall. But that travel time for first due, the 8 minutes like we just mentioned, in terms of your second due and getting your effective firefighting force in, goes in that 8 to 10 minute range overall for you in terms of things. So first due travel time, we saw it about 8 minutes and 36 seconds. Your second due unit would come on at 9 minutes and 36 seconds. And then the third due was more closer to 11 minutes and 37 seconds overall. So not within the ranges you want to see them, but somewhat in terms of overall reality. The fire department's overall response time, you looked at in terms of 9 minutes and 17 seconds in terms of things. And these, we put a note down there, is that the NFPA standards are national standards. They're a goal really kind of to achieve. In many cases, you need to look at them locally and understand your resources. Even though you don't meet the NFPA standard, the Fire Protection District Board should adopt a standard, a local standard, that says we expect the firefighters to get out of the building this fast. We expect the firefighter this response time. And have those standards to actually be able to measure what you're doing. Because if you're just measuring to the NFPA standard and you're failing all the time, it's really kind of more difficult, I think, to push to meet those standards. I think keep doing that. We put clocks in the fire stations. It looked like, and then we were one of the first, I think, to do it. But we put what we call the shot clock up in the building. It's in the apparatus bay. When the tone went off in the building, the clock started by the front door of the apparatus bay. And it was just a reminder that when they were going out the door, how long it took them to get out the door. And it was something that we actually could work on. Like I said, we're not saying drive fast. We never said drive faster to get. The strategies and overall recommendations. Like I said earlier, we're going to go through another finance section after this. But reviewing policies and guidelines was a recommendation. We thought the department needed to annually target looking at policies to get in to make sure that they're current, to make sure that what they're saying is what they should say. That was something that we thought was critical. Updating, the department did have a strategic plan. It's getting a little long in the tooth at this point. When you look at it, it's 6 years old at this point. Developing a master plan, which is a much more in-depth look. I could talk about this is kind of the foundational look, but a master plan that really starts to focus on what you're going to do financially as you move forward. That capital replacement of infrastructure that you've got, looking at those costs and really understanding those sorts of things as you move. Capital replacement, improvement plan or program. Like I said, easy to say or easy to do when you have money. When you don't have money, you start looking around for where you pull money from to meet your current staffing and daily obligations. And putting money away sometimes for a fire engine that's not going to be replaced for 15 years is much harder to do. Quality assurance when it comes to EMS and data inputs and report writing. This gets back to that collecting data and looking at it and really understanding that and making sure that firefighters, you don't need to have somebody that reviews every report that's written necessarily, but what you do in your system is you tweak the system so that there's certain choices that can be made when there's drop downs so that everybody consistently writes something in when they put it into the report. And then collecting some of the data I talked about earlier, making sure that you're collecting some of the kind of those public health things that I mentioned earlier, knowing if it's a student, knowing if it's an unhoused person. Expanding your public education program is a key consideration. I think just making sure that you're doing, I think I heard earlier, some talk about doing a CPR class later tonight, those sorts of things. Doing those sorts of things that help the community be prepared as well, especially when you have limited resources in the agency, making sure that you have those things so that bystander CPR can start before you're there. Talk a little bit about the shortages and all the things that the training chief needs to do, and looking at dedicated staff within training to manage that and make sure the training records are in place and make sure that people are attending the training that they need to train to. Developing a training and evaluation process overall, having performance metrics to look at when you're doing things. When you come to the training facility and you're going to do certain things, there's time standards and things like that. It's not always a race, but when the bell goes off in the 911 system, it is kind of a race to get things done. So the only way when you do training sometimes to put similar pressure, it's not the same, is to have time standards to measure how soon or how quickly people are able to do certain skills. Creating a community risk reduction plan. This is a fire prevention sort of task, and looking at how you could reduce your risk overall as a community. And that's, like I said, it's a fire prevention bureau sort of tool and some fire prevention bureaus have renamed themselves community risk reduction. Consider regionalization of fire services and emergency medical services. I think overall, when you look at scarce resources, you're out here, you've got a few communities around you, but looking at everybody working together makes a lot more sense than having kind of isolated pockets and trying to build your own thing to be able to do it all by yourself. Not everybody could do it all by themselves. We've seen that even in the most resourced agencies in the state earlier this year. They didn't have enough resources to deal with the fires that they had. So they had to call a lot of mutual aid and had a lot of automatic aid. I know for certain that goes on within those agencies. We did the same thing in the Bay Area. We had agreements where, between Contra Costa County and Alameda County, we shared all of our resources back and forth almost seamlessly across the board. So looking at doing those things, looking at training programs, looking at other things that make a lot of sense to do those things.
Actually look at regionalism, because, that's something I think about all the time, and how many, we have so many fire districts all around, and they're volunteer, and this used to be a volunteer one too. They had the chief and they had all the volunteers. And I keep thinking, is there a way for us to have a more regional system for the Humboldt Bay region that would, so they're everywhere. You drop Manila, you're all around, instead of just having us to carry that load.
Right. That wasn't something specifically that we took a dive into and analyzing. Like I said, I came from an agency that we covered all of the unincorporated county, except for a few areas that we did contract service that made sense for other departments to provide service into those areas for us. But unincorporated, 5 cities, the three national laboratories all fell under us in terms of the way we ran. Those were all separate agencies to start. So when back in 1995, when the department formed, or 93 the department formed, but 95 I came in with the city of San Diego, the first contract. It takes a coalition though of the willing to want to look at doing that, and agencies to want to work together to do those sorts of things. We had over the years agencies that I think some of our county supervisors that have moved on, retired at this point, so I can say this, wanted to see us take on and take over. But you don't want to take on an agency that doesn't want to be part of your organization. That's not a good thing, morale-wise and other things that make. Developing, I mentioned already, response time objectives. The NFPA standards may not be your standards here locally that you can meet, but having a standard and setting a performance metric that you measure people to and you want to see and improve. And this takes some work to do, but the report gives you the idea of what the NFPA standards are, where you're at today, and then focusing on how you can incrementally improve in meeting those things. And then, of course, tracking performance and outcome measurements. Evaluating methods to add additional firefighters to the response force. We certainly could have come out and said, hey, if you're going to build this type building, you should do these sorts of things. But you guys are already in a situation where financially you cannot afford to even staff today. With some of these tax measures that are in place today expire, they're going to have great difficulty staffing. So what we're saying is, if you can get to 3 on an engine, that'd be a great thing here. If you could start to look at doing other things, and I know folks have said, oh, you need a truck because you're doing tall buildings. Tall buildings don't require trucks. Tall buildings require more firefighters than they require trucks. The aerial ladder is only good to 5 stories on most buildings, depending on what your setback is anyway. They flow water, they do all those sorts of things. They do those well. They allow you to do rescues and do those sorts of things. But you get a tall building, and even a broken sprinkler head takes a lot of firefighters to mitigate the damage that's going to happen. Water does a lot. Water does a lot of damage keeping fire under control. Continued long-range financial planning. This is one of those things earlier I mentioned planning overall. I think the district, and I know the chief and the former chief and the conversations we had talking to them, have been very laser focused on the finances and trying to figure out paths forward as you move forward. So renewal and updating of special tax assessments, we'll talk more about that. That actually, the way the report was done, it was in the first part, came up as something we looked at in the general kind of finance. But when we took a deeper dive, you get a better idea of how much more critical I think it is to the agency. Work with the city and the county on impact fees or mitigation fees. This is something that hasn't been done in the past. It's something that's critical, I think, as you move forward. If you're going to have development happen, look at those, what those are and what they could do to mitigate things. It can't be ongoing. That's one of the general rules when we talk about impact fees and mitigation fees. It's not an ongoing sort of thing, but it's a one-time fee to look at and do that. You have to justify it and do those. Consider implementing a first responder fee. This is one that's kind of controversial in agencies to do. You have the ability when you respond as a first responder to charge for medical services. It's controversial because people look at it, it's like, hey, I pay my taxes, why am I now getting a fee from the fire department to go on, coming on a medical call? So first responder fees are out there, yes.
So what comes to my mind is that we have a corporation that owns the ambulance company in Eureka, and the same company owns the ambulance company in Arcata. And they seem to be running short a lot. I feel like our fire district is backfilling for their shortage, yet they have exclusive contracts against any competition, and they are actually charging. So is there any way that we could, how can we connect to that?
Yeah.
Because I feel like that's going to be our first breaking point if we can't, if we continue in the same direction that we're going.
So you do have the ability, not necessarily as a fire protection district, the county EMS agency, when they're awarding an exclusive operating contract, what happens, and they have to go out every 5 to 10 years to be re-awarded by state law. So what happens is when they write the RFP for that, they could include enhancements where they give extra points for different things. And you commonly see sometimes is a first responder, some sort of mitigation factor that fits into there. Where I came from, it didn't make or break us by any means, but for every ALS, Advanced Life Support Unit, we have on the street, we got, I think it's $24,000 a year doing now. Like I said, it wasn't a ton of money, but it was something, that's changed over the years overall. So that's something that you can look at. That's something that you would work more with and I said it's a multi-county EMS agency, but you would, as they work to do an exclusive operating area, that's something that you would could look at as part of it.
No, I was just curious, that's similar to what Reading was doing for the fall assist for the fire trucks being deployed.
I don't know. I'm not.
They just did that.
Reading was they began charging for lift assist and it faced a lot of political recoil and they rescinded that and actually reimbursed people they had already billed.
So a first responder fee here, that's why I say it's very controversial. We did not do a first responder fee where I came from, and many agencies don't for that because people feel like they're paying for it, the service already.
And they may be reticent to call when there is actually a need.
That's true, yeah.
Or they get called and the person can't afford it, somebody else called.
Right.
Which is why they're on the sidewalk, can't afford to pay you. So,
Yeah, no, I've done on calls where people don't want to go in the ambulance because they recognize what it costs to take an ambulance ride.
my question is what Randy just mentioned. So we often, our fire trucks are there for someone that's, whatever it might be. And then the ambulance comes afterwards and takes the person wherever they might go. Why isn't the ambulance coming first before the fire department?
You know, staff enough ambulances.
There's few, yeah,
Whoever
so
gets there first.
very generically, there are fewer ambulances in the system. The ambulances work on a dynamic system where they move them around. Maybe. They move the ambulances around to where they think they're going to need them. But you've got the fire stations that are all located in each community to kind of have that static response time where they come from. So most systems, if not all systems, I think in California, unless the fire department is not on divert, but not taking medical calls. You'll see some larger agencies, when they get a multi-alarm fire, they'll not take medical calls and leave it to the ambulance. Yeah, so it's not uncommon for the fire service to arrive first, provide a lot of the care to the patient, help them all the way to the back of the ambulance, and then the ambulance transfers. One of the things that came up, and this is interesting, 18, was the concept of an enhanced infrastructure financing district. Those of you that have maybe been around for a long time, this is sort of redevelopment, the old redevelopment sort of thing, but it's with permission, I like to call it. So as a coming from a fire protection district, redevelopment areas were formed throughout our county all the time without anybody really asking us, and they would take a share of our tax dollar for 30 years or until the debt was expired. This is much more if you have willing parties that are tax collecting authorities and they're willing to share something, there are shares that can be negotiated and worked out. It's kind of the concept. And like I said, when we were up here, the sense was there was some interest or discussion about that. All right. So over the last several years, the department, we keep talking about the financial stress they're under, but they have exhibited a very, very strong understanding of their situation in terms of finance. It's just about how you get or what you do with the money that you've got overall. So Measure F, which is special district tax, in 2020 was crucial to restoring some of the district's capabilities. Revenue primarily comes for a fire protection district from property taxes and parcel taxes. I think I've said that a few times as we've gone through today already. And so that's 99% of your recurring kind of revenue overall. The ability to generate tax revenue is closely tied to ad valorem property taxes. Fire protection districts tip our property tax base in California. They don't have the different sources that you see in cities where there's sales tax, counties where there's sales tax, and some of the other things. And this is one of the things that kind of creates that gap. Typically, you see fire protection districts that are close to 6 cents per property tax dollar, 12 cents per property tax dollar, and some that are 20. This all goes back to Prop 13, when the kind of the playing field was set way back then on how much you're collecting. So you maybe have, we were 12.5 cents. I know Contra Costa was 12.5 cents. The district right next in between us was at 22, and in an affluent area. So guess what? They had all, I mean, they were able to do a lot of different. So Prop 13 basics. I mean, I assume that everybody kind of understands. Like I said, it all goes back to the limits on what the assessed values can go up in terms of plus voter approval. And this it's a high bar to get through or to get over to pass things. And you really need to focus. And I think the district's done a lot of good things in terms of making the argument, but communicating that argument and getting it in front of the public so they understand the critical nature of it. What increases are capped at? I said 6%, it's 5.595 was the existing base. There's 7.5 on some new City of Arcata developments, David. You were?
I have to verify that.
Yeah. Okay. Yeah, so that was a little bit, that way I kind of called it out, because it's a little bit different. And then our modeling assumption as we go through this does a 3% annual increase.
Push the button up there again.
All right, so plan developments and projection. What we looked at between 2026 and 2035 were 14 different major developments, 135 ADUs that we thought would be going in, and looked at the total new taxable value estimate as $135 million. That is not the revenue that the district is collecting, just to be clear. Year by year breakdowns we'll look at a little bit, and some of the infill opportunity zones that could support growth. All right. So phasing in of assessed valuations is actually, that's a different figure there. But when you look at the ad valorem revenue forecasted, so you've got the base that's here, and then that's what we call the incremental, and then the total tax revenue overall from development. You have to do a lot of different things. You're not going to develop your way out of the financial problem that you're in today. That's essentially the bottom line to what we found overall when we looked at it. You know, there are things, I mean, it would increase some revenue, but keeping up is going to be a problem overall. Okay. Parcel tax-based revenue. So we talked about it a little bit. So there's a benefit assessment from 2006. It's at a fixed rate. One of the recommendations we talked a little bit about is because it's at a fixed rate, it's at a rate from 2006 that seemed reasonable at the time. That's something that really should be escalated, in our opinion, annually. Fix, you know, tie it to some sort of benchmark as it moves forward. Measure F, special tax sunsets in 2030. So before 2030, the district needs to, one of our recommendations is renew or do something similar to Measure F, a special tax. That requires the district to educate the public to what's going on, so that they can hit that high bar threshold that we all have in California for property taxes. There's the detail on the benefit assessment, the benefit assessment detail overall on how it's collected, units of benefit and the amount that is collected and the land designated use that's on it. And this is that one that said doesn't escalate as you move forward. So, the idea is that if it were to index forward, it would hopefully at least keep up for you. But you're in a situation where you have to go back to the voters to approve it. Is your flat annual, special tax details. Once again, the key point here is it's going to sunset on the fire district, and that's going to be catastrophic in terms of the overall budget. When you start to lose.
It was a push for you to get that to happen. It took a lot of work to get that to happen.
Yes,
I worked on both of those.
thank you.
06 and 20.
Yeah, it's tough. I know, that's why I said California has set a very high bar. And people are very reticent to pay taxes across the board unless you really make the case to them and for them to explain it.
Well, I think an important point to that too is to look at that data of who is voting to support those taxes and who is not, and really targeting that. And also, like Alex said, with that regionalization, that like on a whole, McKinleyville will put those taxes down and Arcata will vote to support them. And, as the county is pushing more development in McKinleyville with like the uncenter plan and stuff too, like Arcata Fire District will be providing the services. So how can we, again, that regionalization, work with the county, work with Humboldt Bay Fire to be able to provide service when, we're not there, the county is the one deciding that development as well. And so like they should be at this table in a sense too, like Arcata is the fire district. So.
Well, Sarah, even the name, Arcata Fire District, can be problematic because then folks say, oh, well, that's the Arcata Fire District.
Yeah.
Well,
Back to that public education,
Yeah.
right?
Yeah.
That's a key part.
And we have been making steps. We put the bigger signs up at McKinleyville Fire Station. We put some more graphics on the fire trucks so that people are aware that Arcata Fire does serve McKinleyville, because it has been an issue.
But at least where they're planning to develop is right across from the fire station. So.
Yeah.
And those will be probably those will be mid-rise.
Yeah.
In McKinleyville.
But, even with, and I completely understand your point in terms of communities, and they vary and they have their own kind of personality when it comes to things. And I keep going back to Allen County. Before I retired, we passed a $90 million bond measure for the retrofit of 8 fire stations in the unincorporated county only. The county administrator told me going into it, there's no way you'll get the unincorporated county to support that. It was a big ask. But I did an education campaign. We had other folks that championed more the political side of it, because the district can only do education. And we succeeded by I think it was a tenth of a point, we succeeded. It was a very close call. So in terms of revenue and trajectories, we showed some of the changes here, and I'm sorry, the slide for some reason lost the text at the bottom, but the status quo with things expiring, you can see the revenue drop that's going to occur here in the future as you move forward. So very, very significant issue that needs to be addressed. Just the indexing of the benefit assessment is the gray line that's on there. And then red, I'm going to say is F, is measure F. Really kind of really is much more of a flat. All of them together bring you to having a budget that really is a little more, a revenue that's a little more sustainable overall. So.
What's the timeline on that graph you just showed?
That, the overall timeline, I think ran out, that's
2035 would be on.
2055?
It was 5 years. Yeah.
Oh, it's, yeah. Yeah, 2025 to 2055.
So you're presuming the red line is,
These are
Measure out
with things
and then-
failing, when they fail, right? They start,
okay.
Yeah.
Yeah, we can't see the stuff.
so the combined, this is the combined revenue, integrating different things and looking at the, there's a gap of $4.3 million by 2055. That's a long way out, but that gap, when you look at things, actually is happening much earlier where you start, things start to drop. So actually, after 2030, it's you start to see the divergence. So, so the report essentially confirmed that development yields are kind of modest overall in terms of the ongoing revenue. Talked about the risk of losing Measure F, the index benefit, scenario D. If they all stay in, looking kind of at the scenario D, if everything stays strong or healthy, still there's shortfalls. So maintain, our recommendations when it came to the finances was to maintain the development forecasting framework for the future projects and really try to figure out those projects that are certain to happen. Sometimes projects look like they're going to happen and everybody's really fired up about what it's going to mean for the community and those things, and then they don't get across the finish line in the end. Adopt a diversified revenue strategy, balancing all the different streams. Like I said, still focused on property tax for the most part, but you got to look at the different things and different revenue that may be available. First responder fee may be more controversial. You may be able to look at some sort of first responder reimbursement through the ambulance company as the EOA comes up and talking to your county or your EMS agency to look at that. Renewing and replacing Measure F, you knew that before I got here. And then pursuing voter approval to index the benefit assessment as well. I think that's it. So, there's a lot in there in terms of, it gives you some of the foundational things, I think, in terms of the standard recovery to understand, and the Fire Protection District Board should really look at those. And like I said, putting performance metrics in place for the district itself as you are today and looking at those things. Big focus on finances as you move forward. And I think educating the community as you move forward and you look at solutions that may be there for you. I know there's been, yes.
No, finish your sentence.
Oh, and I was saying, there's been a lot of focus and questions that keep coming up. The scope of work that we did not ask us to specifically, and I know some of the public comments have said, did not ask us to look at the university and figure out how much the university ought to pay for service. Like I said, California law exempts them from that. Universities throughout the state do sometimes do that. I'm involved in a study right now in Oregon that's doing the same sort of thing. I will say that personally, I have opinions that, rural communities are different than urban communities. And you guys may not feel rural necessarily, but that's the way I see it, is that urban areas take on a lot more because we do have high rises and we've got all the populations and all those things in place. The stress that it does put on the fire district is different, but you got to have the data, and that's back to the numbers and understanding those numbers on what's going to go on. And when development happens, that maybe the university's development, that may be going on to a property that you were collecting property taxes on, that now that's going away. So that's something to also consider as well, as more development may happen.
So I think some of the things that we have to look at is we have to look at, are we going to have wildfires? And we're going to definitely have earthquakes because we already have them.
Right.
And some of those things are things that the fire department is going to have to look at and be involved in. And I know there's a lot of concern about buildings being built in Arcata and buildings that are over 4 stories or whatever. But it is really imperative that we have growth And besides having a housing shortage nationwide, we have to have growth or there will not be any money available for the fire department.
No, and I do, the reason our report doesn't put hard lines in the sand, it's for all of you to make decisions locally to understand what's best for your community. Me coming from the Bay Area, it's not that, I don't know it all.
One of the recommendations on that last slide, talked about diversifying revenue streams and all of that. And I know that, most of the money that the fire district gets is tied to property tax. I mean, what other mechanisms exist or what are you suggesting that could be, a way to bring in more money besides just adjusting that cost of?
Yeah, the enhanced infrastructure fee, our district, looking at that, looking at some of the other fees that were mentioned, in terms of service fees. Contracts, they essentially, if the city wants to do certain things, the fire protection district could contract to have a higher level of service in certain areas. I mean, we did that, like I said earlier, the laboratories, they were NFPA 1710, and you're gonna set their contracts with the federal government, no matter what the cost factor. And I would tell you, we bid against private companies as a public agency, and we're still cheaper.
So the scope of work did not ask for numbers, it sounds like.
So that's,
Well, I'm thinking of, what we need for staffing facilities, because one of the things that Senator McGuire, when he came to the city, says, I need numbers before I can go to the state to ask for money. Where are we at with that?
well, there are numbers. Yeah, you're not meeting NFPA 1710. And like I mentioned, most fire agencies in California don't meet all the 1710
I guess I
standards.
was thinking more of numbers and cost, like how much money are we going?
Yeah, so the cost factor on one of the recommendations was to get the three-person company would be to add a firefighter on each unit. The cost factor of that per firefighter today, it's in the report, but it's a year and a half old.
I just have one question. Your projections go out to 2055, and would it make sense to do a shorter term look, like the next 5 to 10 years? Because it seems like collecting better data, doing a strategic plan, having the district come up with their local standard. I mean, all those things take a lot of time, right? But is there a more streamlined way to get to it? Would it be beneficial to look at a 5 to 10 year timeline and then putting those costs forward? I mean, I'd have to think that the district, rather than doing, this plan took what, a year?
Yeah.
Right, so, we're gonna be 2 years down the road before a lot of those things get done. If there's not a more efficient way to get these finished, but would it make sense is there a more streamlined way to look at what those standards are, to get the district to a point of looking at those standards and coming up with, what the cost would be to meet those standards and doing, more efficient projection?
Well, I think, I'd say the district, I believe, is already made many of the changes that are in the report in terms of data collection and some of those things, that I either picked up and talking to the chief that they were implementing as we were going through having the conversations. And it happens with all of these reports. I mean, some of the recommendations are already, I think, underway where they were non-cost items, which is going to give you the data to be able to assess it. And absolutely looking, and this is where I think one of the things the district was doing well is looking at the smaller snapshots in time. The projection on development was a little bit more, we were trying to pull data together and what was going to happen and what may not happen. And that's a little more difficult to do. And I know our finance person was very leery because he and I both have been involved where development doesn't happen. What was supposed to be 3,000 homes becomes 300. It changes the factors. So, but certainly that's one of the financial planning in there is to look at maybe some shorter timeframes. I know that they've started collecting some of the data and doing those sorts of things already. But David, sure, go ahead.
When we first started talking about having a standards and coverage study, what came to me is strategy recommendation number 13, which is evaluate methods to add additional firefighters to response force, because I believe our professional fire staff has made it really clear that we two people in a fire engine, 64 square miles, is just not enough. And I think one of the unfortunates, and it's nobody's fault, it's just that we didn't realize when we did Measure F that the gateway was gonna charge ahead so much, and we didn't know that the university was gonna be building, mid-rise dormitories, housing 800 kids at the same time. So that kind of caught us off guard, because the Measure F is not designed for those types of things, and we were kind of caught short on that. So,
Nor should it.
well, exactly, but I really appreciate, because we're all serving, I appreciate having the city council here, I appreciate the staff, I appreciate having university representatives here, because in reality, we are all serving the same people. We have the same constituents. And we really need to work together to find out solutions, because I hope when we leave today that folks understand that we do not have enough personnel in the Arcata Fire District to safely manage a lot of the call volume and standards and coverage that we have for the community. So I hope we can work together and not be
I
adversaries.
think we understand that. I mean, I think, David, do you want to say something?
Yeah, are you done?
Did I interrupt you? Did I catch you off, Randy?
No, I'm done, Alex. That's
Okay.
okay.
If I could jump in, and I think that's, so you all started working on this together, right? The three, the university, the city, and the fire protection district, which I think was a huge step in the right direction just from the very beginning to enter into it, to talk about that. The reality of adding firefighters is that where you're gonna find revenue is really difficult to do at this point, because of the tax structure and the way things are.
David,
So I had two questions that I thought you could address, and one thing I wanted to address too, in terms of like, I think certain, the perception of what this report, what we maybe thought it was going to provide in the beginning, what it's actually providing, and just recognizing that this is the first step in sort of a more comprehensive plan. I think that maybe we thought about it initially as sort of a way to show us a path forward. And what I realized working with your staff, in particular on the property valuations, and you just kind of reaffirmed, sort of this feeling in saying that, you were leery of putting forward these projections because they may or may not happen. And the intent behind the property valuation exercise was to start to paint a picture for the community about what the future may look like. Not that we'd be using that for budgeting, but that we'd be using that as a vision forward. Your report says it, and we never got really down into exactly what my thinking was in adding that particular provision to the contract, but your report concluded, based on our current tax structure, the approximate 6% the district gets, that even these large scale improvements and projects that happen in the future aren't going to significantly affect the district's underlying tax base. And obviously, there's an additional tax measure that needs to come to replace Measure F. And I think we've all learned ways to improve on Measure F for the next go around. And you hinted at the EFID, the Enhanced Infrastructure Financing District, and how that could maybe have an impact. So here's my question, and it's a long set of questions. You had mentioned earlier that there was a district near your district that got about 22 cents on the dollar, and that was a lot of money. That was about it. If we had an EFID, if we created an EFID in these particular areas where we're going to see this growth, it's not going to quite have the same impact as having 22 cents everywhere. But if you had 22 cents on the dollar in each of these areas, just what's your gut reaction to how that would improve at least the ability to offset some of the capital needs for the district, so that they can concentrate their ongoing revenues more on staffing?
Yeah, so based on my understanding, and like I kind of mentioned earlier when I brought that type of district up, it takes parties to agree to do it, so you don't see it happen very, very often. There's not, I don't have a lot of history with them, other than, like I said, with redevelopment. But yeah, you could generate pretty good amounts of money in those, but those usually, they have a sunset on them, right, as well. So you can do those things and create enhanced infrastructure districts that are focused on some level of improvement in that area. I would tell you, the one thing that becomes difficult is how you balance it, especially with a fire protection district that covers multiple communities. Equity becomes, I used to hate to stand as the county fire chief up and talk about, people who want to start counting calls. How many times you went here? How many times you went there? I didn't care about doing that. I mean, so you've got to be cautious, I think, as well, when you raise the service in maybe one area of the fire protection district, that later on looking at it, people aren't feeling like, that resource being paid for here is getting pulled over there. So I think you got to be careful on how you craft them.
That's a communications challenge for sure, but I think that, the impact of the county creating EPID in McKinleyville, and the city creating an EPID in, the gateway areas where we're anticipating growth is a good first step towards finding that partnership where we can offset some capital needs. And then the second question is a lot shorter and quicker and easier. You had mentioned that the district should come up with its own standards. And I was wondering if you have examples or can provide us examples of similar jurisdictions or districts that have developed standards, just so that we get a sense for what those look for.
Yeah, we have, I'm certain we do. We like it to be kind of local, looking at the data that you've got. The one critical thing that when we go places, a lot of folks, you need to focus on the 90th percentile. That's the measurement that, 90 that you need to look at, not average. Averages get abused in terms of responses and things like that. So that's why that threshold, the 90th percentile, is critical when you do it. And one of the first questions we ask when we go into a district or a department is, how have you been reporting your data? And the minute they tell us that we're doing averages, it's like, okay, we're going to need to work with your board to understand why our data is different than what you've been reporting. But I think that's definitely something that they need to do. We could supply some of the information, but back to the NFPA stuff, there's some of that's laid out, and then figuring out where you're in it and what the reality is. Yes.
Just focusing a little bit on what Randy said and what David said, which ties together is, it is about working together, and we have a community. Humboldt County knows how to come together. We're a generous, intelligent community, and it's about really telling the story well. And if we make the problem the villain rather than the entity, whoever that is, the villain, that's going to go much better for us. If we can all come together on the shortage and need for more resources in the fire department and not blame it on anything, whether it, be the gateway or a dormitory, and pull that out of it and focus on how do we get resources for the fire department. That's something our community can do. I mean, everybody loves the fire department. They're the most popular people in this room, right? So I think we can do that. But if we argue about the stuff in there, the people, the buildings, whatever plans, that's not going to get us anywhere. So it's really about coming together and villainizing the problem, not the entity.
I'm Bethany Gilden, I'm the Chief of Staff. I'm here representing President Sonia from Cal Poly Humboldt, and I thank you for saying that, because I think that's the piece where we do have laws and rules that prohibit what we can do, and we can partner and we can advocate and we can lobby at the state level, even with resources that the CSU does have, and those are the pieces that we're absolutely committed to doing in that partnership.
So I'm one of the board members, and I think one of the first things I would like to see is the university and the city formally recognize that we are resource short. When I read press releases about the dorms, and there's little paragraphs about how there's all this fire safety and stuff in there. Essentially what I'm hearing is our concerns that we've raised are not real. And we don't have enough people. And part of, and I commented before that, Randy said Measure F wasn't designed to cover 4 to 7 story buildings in the Gateway area and wasn't designed to cover 7-story dormitories. And it shouldn't have been. It was designed to cover the standard delivery that we need now. And if we should have 3 people on an engine, and that should be paid for by our current constituent base. But I don't believe personally, and the board is the authority and has the responsibility of establishing for the community what the standard of coverage should be. And we will work with our chief. I was very disappointed in the report. I did not see the scope of work. And, as a board member, we handed this off to our administrators. And the way the scope of work was written, I think if we would have actually looked at it, we would have had some serious questions about whether it would give us the answers that we really wanted as board members. That said, the subject matter expert is our chief and his assistants, and we will develop a recommended standard of cover for the area. And we will, I'm not going to predict what it'll look like here today, and I don't know whether it'll just have engines, and I don't know whether it'll have a truck in addition. But I think it will be considerably more than 3 people on 3 engines. And the funding of that funding above 3 people on 3 engines really needs to be taken care of by the state and the university system. One of the operating principles and the communication that comes from the campus is that we have laws and we have restrictions, we have this and that. And one of the primary foundational principles of special districts is that the parties that create the demand pay for the services. And that's the way the state set those up. That's the way the Measure F is set up, so that how much you pay into Measure F is based on the impact you have to the services. The same thing with benefits. And our benefit assessment does need to be adjusted for inflation, and it needs to have an inflation factor put on it. I would like to see whatever we do, however we do our finances, whether it's just with one assessment or whether it's with a benefit assessment and a special tax. I think the board needs to wrestle with that a bit. But they need to have, no sunset. They need to be adjusted for inflation, and they need to have an inflation factor on them. And for me, they need to cover 3 people on 3 engines. And then we need to design a funding system where the 4 to 7 story buildings pay for if we need a 4th station, if we need a 4th engine, and if we need 4 people on all of our trucks, and if we need a 4th engine with 4 people on it, then those entities need to fund that, and it will not be cheap. But the current residents and the people who occupy residence here in our district shouldn't bear the burden of a transformation of the service level that is going to be needed to provide coverage. And
I know we know there's the issues. And I think we've made, this is a beginning. That's how I would look at it. It's a beginning. It's giving us information. Now what we need to do is move on to what would be our 2nd step, and then look at our 3rd step and figure out how we're going to pull this together and make it actually work. I don't think anyone in this room says we don't have an issue. We do have an issue. We have many issues. And so how are we going to start moving forward? I think in a collaboration with the city and with the fire district, and also with the university has a really good lobbying mechanism that they can really help us with, which is a better lobbying mechanism than we actually have, or the district or the city. And I think that's where they can come in and really be strong and help us. So I think this is our first step. Now we have to figure out what our second step is going to be. That's where I would come from. And we may not be able to solve it right now, but we take this information and start to mull it over and figure out how we're going to do this. There's so many things that came up we need to look at.
I have an outside the box thing, since we have all the captive audience here. Just a brainstorm thing. CAL FIRE has really been stepping up, doing year-round. When we did Measure F, CAL FIRE was not a year-round fire department. And now that California is burning, the state has really it greatly enhanced CAL FIRE resources to year-round. And I would just like to throw that out to our partners at the state level. Look at having CAL FIRE put a station closer to the state resources that we have in this community. We have a substantial amount of resources. Right now, we do have CAL FIRE as they are our automatic aid from Trinidad. And every time we get a call, they're rolling from Trinidad. Now they'll send an engine down. But it seems like there's a stretch between the Trinidad station and the Fortuna station, since there is a huge investment from the state in resources in this community. For instance, our fire district does have property where another fire station can go. We could do I'm just brainstorming, a collaboration with the state. We can have position a CAL FIRE engine in Arcata, right next to an Arcata engine, and then we would have an additional crew to manage, because really the state, in my opinion, needs that coverage for, my brother was the head RA at Cal State Northridge when they had a fire, and the buildings don't burn, but when they're made out of concrete, but the contents inside do. And his fire, the entire floor was instantly filled full of smoke. And of course, they had the Los Angeles Fire Department come to, with multiple engines that we don't have here. So just a thing, just a thought. I understand the state can't pay our fire district funds out of property tax, but the state could put another fire station here to help.
So aren't they doing one in Rio Dell, CAL FIRE?
They're going to move their Fortuna headquarters to Rio Dell. So they're even moving farther south.
Maybe to Randy or to Eric, a lot of those next steps that are identified in the report really put the burden on the district to determine what that coverage standard is, right? So to Alex's comment on, can we work together on these next steps to start from here? But to just say, hey, the university should pay for this amount, there's no basis for that until that standard's developed, right? So.
Well, no, not really, because, we represent our taxpayers, as the council members do. And our job is to advocate, is to have the fair share of payment. And we literally have a city within the city that we're not able to contribute to that service. And our biggest problem is, while we understand the property tax issue, our folks, our voters in McKinleyville, for instance, see everything that's going on in Arcata. And when we go to do a Measure F upgrade, they're going to be reticent. Our data tells us that the McKinleyville folks are going to be reticent to pay for enhanced services for fire service. They think Arcata projects are generally.
Yeah, but it's going to change. It's changing in McKinleyville, and there's a lot of planning that's going to go on, and so we no longer need this. They will be focusing on things that are happening in McKinleyville.
I think it's also important to remember too, that while the university doesn't pay property taxes, we have been paying the 2006 benefit assessment tax and the 2006 special tax. And those are based off the properties that we own within the district. And not to say that, oh, that's enough, but to say when we talk about reassessing those assessments,
from the 2000 voter approved 2006 benefit assessment and special tax assessment. That is an example of where that would have a direct correlation to a pathway for the university. But I do love kind of, Randy, the out of the box thinking, because I do think there's such an opportunity for the university to be able to be a solid partner in some of this more innovative thinking. I even think of like when we talk about the renewal of the Measure Act tax, right? We have so many resources. We have students who are begging to look for opportunities to do marketing campaigns and all of those things, and leveraging a lot of the resources that sit right across the freeway from us right now to say, how can we help bolster that so that when we go back to our communities, that educational component, right? And all of that isn't just falling on the district. How does the university help with that so that we're hitting this from all angles and not just from one? And I think that, and I look to my partners, or my leadership actually, to say, I think we're all very much so committed to that. And I think it will have to require a little bit of a creative thought process on some of it, but there's absolutely a pathway to this, you know, to the university being able to be a solid partner with the district and getting us where the district needs to be.
Thank you. We would really appreciate that.
So I feel like messaging is really important right now. I hear constituents already getting riled up, and I do agree that the burden should not necessarily be put on working families, our older adult community who are fixed incomes, retiring students living in the housing that do not require mid-rise residents. And so I think maybe there's been some misinformation in the media, and I think that's what's causing the divide. So maybe, you know, if the Arcata Fire District is amendable, perhaps the city, the university, with our wonderful students can work on that messaging piece so that we can, you know, head it off before as we begin to sort out how we're going to finance this.
Also, I mean, I get it that the taxes come from property taxes, but we're all valuable in the community, whether we're a property tax paying person or not. And just using the university as an example, yes, you're your own small city with thousands of students that contribute in many ways, including financially, with the income and money that they bring spending in our communities, amongst other things. So there's so many ways to look at it. And again, if we can just keep, when we move forward past today, keep bringing it back to how do we find that money? How do we work together? Just like bring it back to that, because we have to just, it's not going to be even. I mean, life is not always exactly even. We just have to figure it out.
And Stacy, the one thing that we've talked about, university staff, city staff, elected officials, is, you know, we think we're going to have a lot better chance going after this unified and really approaching the problem. Like you said, let's approach the problem, but let's work together on it. You know, last time I think there was some breakdown and trying to talk with elected officials or the funding, and that didn't go well when there was divided opinions and it was adversarial. So I think this time we really want to be able to work together with one message. You know, here's our problem. You know, we have some financial projections. We need some more work by the district, but let's support that for the whole community. So I think we do need to pull the county into. They're noticeably absent at this point. So I think we can work to do that. But I think, you know, coming out of this more, okay, working with the district as they determine what those next steps will be, and then really pulling into it as a shared effort.
And just a curious question, you know, for any of the fire directors or the chief, have you guys been engaged in any of the McKinleyville Town Center planning work that is actively taking place?
Recently, we had, in fact, there's a meeting tonight. It's probably in this.
Yeah, okay, you're on your way there next.
Better wrap this up so you can get there.
So there's not really an action, it's just to receive the report, and ask questions of David. So, you know, I appreciate David being up here twice for the same meeting.
Yeah, thank you.
Even though I went to the wrong place first, it was a nice, you know, change to have it here too. So I was looking at the old agenda. It's like, oh, he's in here.
It's close enough, right?
Oh, that's good. I was gonna be late.
Welcome to come anytime.
More late.
I have come. It's just a fall, but
So the only other thing I would add as a director, speaking for myself, not for the board as a whole, but, you know, my highest priorities are the benefit assessment and Measure F, strategic plan and master plan, take a back seat to that. And along with those two, it's developing in conjunction with the chief, recommended standard cover community.
Well, I think, Eric, what could make that even more powerful, because I think you're concerned about some near-term things, right? Like, what do we need?
Yeah,
Right, but if we can show the community concurrently the bigger picture, I think that will be powerful. So I think it's worth really pushing for both, because just putting Band-Aids on things isn't, it works, but temporarily, if we can show as a group, here's this big picture, and here's what we need to happen right now, so that we can achieve these goals, I think that that would really help with those near-term things that we need.
and I think we're gonna have to look at the, putting it together, that we have some kind of a group that's gonna meet on a monthly basis, and they're gonna start moving forward on solving some of these issues. And,
Are you recommending a task force?
you could call it that. And it could have citizens on it if you want citizens.
We'll take that as direction to staff to look into ways.
I think it would be important to include the community members for transparency.
And I think too, I am pretty interested in this idea of the enhanced infrastructure, district, and David's idea of talking about in these different zones, especially again, when and if we engage the county and what's going on with McKinneyville as well, and look at that area specifically as, so these caught off surprise, they've started their planning, it's happening, and it's probably gonna happen. So,
I'm not in the table circle here, but thinking just about this group, I think we'd be really cutting ourselves off if we didn't ask for some student input and all this, on a task force or community. I think there's some, I would have loved to see this study done by students and their advisors.
So I think now thank you, Judy. I think we're at this point now where we're gonna have to take all this and move forward. And we're not gonna solve it today. So thank you. I would say, if you're willing, Blaine, to thank everybody for coming, for their time.
Well, I just wanted to piggyback on what Judy said, is that when we were looking about the relationship with the Arcata Fire District, students were at 0%. So I don't know if they just weren't being surveyed or if they didn't participate, but yeah, moving forward, I agree. I feel like the college age demographics are super important, because they're not feeling confident right now in the district's ability to provide protection for our taller or high-rise buildings. That's what I'm hearing, anyway, with the students that I'm working with through my daytime job. I have several interns, and so, yeah, let's get these students involved.
So let us move forward. We're
Yeah.
not gonna solve it today, so let us get you, all you guys that are head of different things, like city manager, you, Beth, the chiefs. We're gonna put it together, and we're gonna figure out what task force and how to have open meetings and to have ideas come forward. And Randy, I love your CAL FIRE, and I hope you're out there promoting
Well,
it.
can I ask before you dismiss, we did promise the public that they could have input, no?
Yeah, there's nothing on there.
Okay, I thought that you had said that there might be something at the end.
Yeah, I thought there was a discussion at the end of it, that would actually.
Well, we could certainly, I would vote to allow public input if they would.
I second
I
that.
would like to hear public input.
Well, I'm not able to stay. I'm gonna have to be.
I just want to make sure that they feel heard as well.
Right. I'll stay as long as people want to give input.
Same.
So thank you. I'm gonna stand by. Thank you all for coming. I appreciate
Is
it.
there, or give us a way to give an input to somebody?
Do you want us to go up to the podium there or casual here?
Let's do another 3 minutes. Is that,
The Lord and council's call on that.
thank you. Is that good?
We were talking about public information. We have public here, so I want to hear from them. So
Let's
I
do,
would say go to the.
Yeah, up to the podium and, please limit your
Let's,
comments to 3 minutes.
Thank you.
Okay, I'd like to point out that something I read this week, that over 1/3 of our population is on Medi-Cal. So, since we're talking about finances, if you don't know what Medi-Cal is, that's extremely poor. So our Humboldt area is not a wealthy medium, average medium compared to the Bay Area, especially Mill Valley, Atherton. So, I mean, this is going to be really a difficult situation from the standpoint of, especially what's going to happen and the Medi-Cal in 2026 when, you know, it all kicks in and people are going to be losing, that we're going to have a lot of people that are pretty desperate. So I don't see how the whole taxing from the standpoint of, you know, you're talking about 4 to 7 stories, how you're going to get money out of people in that situation. And we have a lot of retirees, and I think sometimes when you're a 6-figure employee of either the university or the city, you don't understand that a lot of people that are out there are on a fixed income Social Security. And so I just don't see how you're going to get money out of that end. Maybe you're going to get some money for, you know, cost of living, but the whole idea of the 4 to 7 stories and the financial from that, that's a big dream. It's only going to come from, I mean, if the university can go to the state or McGuire and get that kind of money, then, but I would say we're kind of like behind the schedule here because the buildings are done, and I would have thought that that would have been sort of happening already. So I'm a little concerned that, you know, is it just talk? Or are you really going to deliver on that? Because if you don't deliver, I don't see the other revenue streams with, you know, with yourself, the university, or the developers who, as I mentioned, Sorrel Place, they don't contribute to taxes and they pay very little. And so what is your revenue stream from that standpoint? So it's nice to say that, you know, let's all come together, but what is the answer financially? I don't really feel very comfortable with what the remedy is going to be. And so it's just, I think you had a choice. I mean, I've taken art history classes and architecture, and you could have just kept it under 4 stories. I mean, 600 years ago, we had architects that designed cities that are fantastic, and the ones that have survived World War II. We have like 750 million people going there a year.
Thanks, Greg.
So you could have like gone that direction too.
Hold on, please. Okay, go ahead.
Hi, the one thing that I haven't heard very much in this is the possibility, and I don't know how this works, this is out of my wheelhouse, but, the possibility of developments that build 4 stories to 7 stories above what the current fire district is able to protect, if they contribute more into the fire district's, funding with a new development. I know Alameda did that, with a big development. The development actually paid into a new firehouse and staffing, quite a few years ago. I have relatives in Alameda, so that's where I heard of it. So, and I have firefighters in my family that, live in Alameda and work in Oakland. So I was just wondering around that logistics, I don't know how that works, but, of just having them contribute a little bit more, financially with a big development, if it's a big development that goes beyond the capabilities that the fire district has now. Anyways, I said that out there.
Yeah, sure.
Hold on. My name is Joanna Carey, and thinking outside the box, I try and do that a lot because I'm not a big believer in boxes. I like domes. But anyway, the students, if we're talking about the university and their involvement and what they can contribute, the students, many of the students I've talked to on campus, their summer jobs or working for CAL FIRE or post-graduation. Some of them I've learned they've gone off into service efforts, like my housemate graduated 2 years ago and she's an EMT down in Southern California, that those living in the spaces that we're talking about needing to defend and assist, perhaps part of living there is being part of a core of learning some sort of, internship fire type of thing. If we're talking about the university properties, there's college core, and maybe college core can expand into, fire department assistance so that they're on site if there's something that's happening and they're learning how to contend with it. And I know that's kind of, maybe naive thinking on my part, but we really need to think about how we are going to adapt in a climate changing future when fires are becoming more and more, wildfires in our community are becoming more and more prevalent, and other issues, tsunamis and medical crises, whatever, that our younger people coming along are not just recipients of that, but participants in a whole societal model of taking care of themselves and the community in an educational capacity. So I just wanted to put that out there because I understand those new dorms cost a lot of money for people to live in. And maybe if they had an opportunity to learn a skill in addition, and get compensated to help pay off the dorm fees and, have a better comfort level maybe of living in a place that has potential to be unsafe on occasion, thinking about that.
Thank you. And we have had those discussions with Chief Emmons about potential internship placements and recruitment and creating a pipeline utilizing our fire science program specifically as well. And so I am excited to continue those conversations because I think there's such potential there. And when we talk about adding bodies to rigs, that's a great opportunity potentially.
I'm Fred Wise. I think it is best for me to communicate by email and through articles. I'm still very upset about the report. I feel that a distinction needs to be made between funding, which keeps more or less status quo, or provides 3 firefighters per station, let's say, versus funding that would be required to fight a fire in a 4 to 7 story building. They're 2 different things. Make that distinction. Raising funds to, as I say, keep the status quo or go to 3 stories, that sounds feasible. Going beyond that, I don't think is feasible. At the same time, I want to assure everyone I am optimistic. I think you get that from my emails. There are solutions, but we need to go much beyond the status quo, much beyond it. In terms of the report, my disappointment is that we're a year and a half since the report was commissioned. We really don't know more than we knew 2 years ago. The same problems exist. They were defined 2 years ago. Not much has changed. I don't think the report adds very much to our knowledge. There's a lot of data, but not real information that we can work from. I think it should be rejected. There's a lot that can be done, and I think people will rise to the occasion. I've talked to some members of the board. Again, I'm optimistic, but it's just doing status quo is not going to Not going. Well, the rest I'll say. Thanks very much.
Good.
Anybody else? Okay, does anybody at the tables have any last things to say before we adjourn?
I would just add in that what Chris said, staff, city staff and Cal Poly staff, recently, we have been engaging in conversations on how we can work together. So I do want to put that out to the public that we are establishing relationships and good channels of communication. So
I just wanted to commend that conversation of utilizing interns, college core, and getting the students involved. That's exciting.
Well, thank you all, everybody, for coming.
Thank you.
We're adjourned.
Thank you.
Thank you.